Good afternoon, CG dolls, and welcome back to our YouTube channel. Today we are with Dr. Hunsaker and we are talking boobies. So, Dr. Hunsaker, can you give us a little bit of advice or tips? What should we do or not do after a breast augmentation surgery?
Well, it's mostly what should you not do, because the healing process pretty much takes care of itself. But we want to limit your activities, and the reason for limiting the activities is to reduce your risk of a hematoma or bleeding after surgery.
Correct.
So I usually tell patients no heavy lifting, pushing, pulling, strenuous activities, or cardio for at least 7 to 10 days.
Okay.
People commonly ask, when can I drive?
Correct.
Usually at least 3 to 5 days, because you have to be able to be a safe driver. If there's an accident or something, you have to be able to justify that you were driving. They also ask, when can I go to the gym? We'll have that same restriction on, and then when they go back, they pretty much self-limit.
Okay.
Because they're not comfortable doing flies and lat pulls.
Correct.
You know, and they'll ask, when can I go back to work? Well, it depends what you do at work.
Correct.
You know, if you're a desk person, you go back to work tomorrow. So how are you going to get to work, though? Are you going to drive, or someone else going to drive you?
Right.
You're working from home. And then a very common question is about sex. When can I have sex? And my explanation is usually, look, good sex is going to involve either heavy lifting, pushing, pulling, strenuous activity, or cardio.
Correct.
So can you just put a lid on it, you know,
Okay.
in a week?
Correct.
So that's pretty much how I frame limiting the activities and putting the restrictions on the patient and why.
Perfect. Well, thank you so much, Dr. Hunsaker, for your tips and tricks after a breast aug surgery.